Hey guys, and welcome back to another video. And this video is going to be very ad hoc because I want to look at this particular YouTuber that I've been seeing a lot lately. His name is Dr. Abs. Dr. Abs. Wow. I mean, maybe he has a good set of abs. But anyway, he made this video recently that kind of has been annoying me. When I watched it, I was kind of pissed off. I don't know why. Maybe not pissed off, but I found it to be particularly weird. So the premise of this video is that basically, Dr. Abs looks at this very old study from 1966, and this study talks about how topical testosterone propionate could be used to reduce skin aging, the effects of skin aging. And they look at really old people, like people who are in their late 80s to early 90s, and they apply the topical testosterone ointment to parts of their body to see if it can de-age their skin. Now, what I found to be, and again, I'm not going to play this whole video. I don't even think it deserves to be fully played, in my opinion. But if you guys want to go watch it, you can go watch it. But essentially, Dr. Ab suggests that, oh, this thing it's been hidden, long lost or buried research that showed that this method is more anti-aging than anything available in the skincare industry today. The problem with old studies is that, okay, one, it's not to say that old studies aren't valuable by any means, but you have to make sure that the claims they make aren't outdated. Sometimes, let's say, it's right now at the time of recording this video, it's 2024, right? There could be a study that comes out this year in 2024, and in 4 years, 2028, aspects of that study could already be outdated, right? Now, imagine a study from 1966. That's pretty ridiculous if you're going to. What I'm going to say is this, right? It's likely that a study from 50 plus years ago it's likely that the claims it makes will have at least some things about it that aren't necessarily true, or maybe that has been further elaborated on. And maybe it could have some claims that could be carried out to their logical conclusion, right? I don't want to get too bogged down, though. I want to kind of look at some of the claims that he makes, right? So, this part of the video, it looks at a part of the study that Dr. Abs is talking about, where in a single subject, they looked at one part of the body where the testosterone cream was applied, the ointment was applied, and another part of the body where it wasn't, right? In the same person. So you're using the person as both a treatment and a control, right? And they, I guess, saw signs that there was a reduction of certain skin aging effects in that particular tissue.
Look at this side. The hair is more dense, it's longer. You can't tell the color, unfortunately, because I didn't have color pictures back then. But you can see the density of it, and the surface area is actually growing out to the side, whereas here it's just in this sort of middle section here. Now, here they used testosterone. I'll read it for you. The untreated site typifies a great regression of axillary hair in old age. So, what they're saying is, in old age, you notice the hair reducing, whereas a testosterone effect, and this is critical, please pay attention. The effect is strictly limited to the hormone treated side. What does that mean? I know you guys are thinking, well, how can this not have a systemic whole body effect? Because we use testosterone gel for a whole body effect. I'll explain that soon. But if this had a whole body effect, you would see changes on both sides. But the untreated side was exactly the same as when they started, showing it was just a local effect.
Okay, so something is being lost in translation here, right? You can have a local effect as well as have systemic absorption, such that the local effect is significantly higher than its influence would otherwise be if it were systemically absorbed, right? So I'm not sure what he's trying to imply here, right? Okay, so they applied the this is someone's armpit, by the way, right? they applied in the same person. It looks like as you get older, you get less armpit hair. But in this individual, they applied the testosterone cream to one armpit, and when they applied it there, it increased the hair, and it made, I guess, the collagen in the area a bit more robust. But then Dr. Ab says, along with this study, listen, if it did have systemic side effects, you would see an increase of hair on both sides. So that means that it only had local impacts. That's not a good conclusion to make. That's a very outdated way of looking at things, which is why I'm kind of surprised by this doctor. Dr. Abs is, to my understanding, an actual doctor. I'm kind of surprised that he came to that sort of conclusion here. We know that when it comes to sebaceous glands, that androgen activity is significant, right? It can influence hair growth in local areas, right? It can also stimulate collagen production. Like, we know this. But the reason why using a testosterone propionate cream would be a bad idea is actually for this very reason, right? It comes to the influence of androgens on sebaceous glands. So there are numerous studies that show this, but when it comes to the activity of type 1 5-alpha reductase and other 5-alpha reductase enzymes, so type 1 and 2, it causes the sebaceous glands to increase sebum production, right? In quote unquote, looking at this study by, I think it's Dene Tibutot, increases acne production in acne prone areas, right? There's a high amount of 5-alpha reductase activity in the sebaceous glands. So, there has been speculation, at least in this old study. This study is from, I want to say, it says 1995, right? So there was speculation back then that perhaps we could use 5-alpha reductase inhibitors to reduce the presence of acne by reducing the 5-AR activity in the sebaceous glands, which would slow down sebum production, right? And if you slow down sebum production, there's not a lot of sebum that the bacterial colonies can feed off of. However, we know that androgens like DHT can actually cause the sebaceous glands to overproduce in sebum and create conditions like acne vulgaris. We know this, right? If we look at, let's go to this paper right over here, right? The cutaneous effects of androgens and androgen-mediated sebum production and their pathophysiologic and therapeutic importance in acne vulgaris. Going to this part of the page, androgens such as DHT regulate sebaceous gland activity by binding to androgen receptors expressed in sebocytes within the sebaceous gland and stimulating the expression of genes that promote sebum production, right? So it doesn't make sense to apply more of those androgens, particularly testosterone propionate, to the skin. And we already know that it's having a localized effect, right? It can have a localized effect without it being a danger to it can have a localized effect without it having significant systemic absorption, but that doesn't make it good, right? If you somehow trigger acne vulgaris or excessive acne, that's not good when it comes to de-aging your skin. So his very suggestion that, oh, this is a good thing and it's good for reducing skin aging is kind of ridiculous. So encouraging the pathogenesis of acne vulgaris is a good thing, right? Let me show you acne vulgaris. Can't speak. This is acne vulgaris, right? If you get severe acne vulgaris, damn. If you get severe acne vulgaris, you can have acne scars. And, that's not really good when it comes to skin aging, right? This guy over here that I'm showing on the screen right now has acne vulgaris. Cystic acne, rather. You think it'll be a good idea for him to apply testosterone propionate on his skin to de-age it? Rather, let me ask you this question. After his acne vulgaris goes away, and when he has skin scars, do you think it would be a good idea to apply topical testosterone propionate to his skin to quote unquote reduce the signs of aging? That doesn't make any sense. So why the hell would he suggest that, Dr. Abs, right? We know with drugs like Winlevi that when you use Winlevi, it is a steroidal androgen receptor antagonist, right? So it goes into the sebaceous glands, it goes into the sebocytes, these cells, and it binds to the androgen receptors in those cells, and it blocks DHT and other androgens from stimulating those sebocytes. And once it does that, it blocks the genes that help regulate sebum production. If those things aren't blocked and DHT can freely bind to it, it increases sebum production. And that makes it a very rich environment for bacterial colonies. They feed off of it, further inflaming the skin and possibly encouraging the chance of getting acne vulgaris or other sort of dermatological conditions that aren't good. So by blocking it by using Clascoterone, right? By blocking those androgen receptors, DHT can't do that. And it can kind of ameliorate acne and reduce sebum production. And this will kind of eventually reduce the bacterial colonies and then kind of reduce the inflammation overall when it comes to acne and reduces the presence of acne. This is how Winlevi got approved, right? This is how it got approved. And it's safe to use in males and females, right? So why he would suggest putting on topical testosterone is some sort of fancy, trendy thing, and they were hiding it. The industry, big skincare, has been hiding this all along, and they don't want you to know it. Why he even gives that off as some sort of, possibility is ridiculous to me. It just makes no sense. And one thing that I found to be particularly concerning is that when you go to the comment section, of his videos, of this particular video, somebody asks a question. They say, quote, "Surely this is only good for men because women do not want to grow facial hair," unquote. And he responds, and you can see my comment over here. He responds, quote, "The hair is already there. It doesn't grow new ones." Okay, that may be true, right? That may be true. It doesn't grow new hair. Let's just take his word for it, right? It certainly stimulates hair growth. You've shown it right here. You've shown how topical testosterone propionate can stimulate hair growth, especially in the armpit. Why wouldn't it hold true for the face or the beard area, the maxilla area? The fact of the matter is, it does hold true. That can happen. I'm going to show you a condition called Hirsutism, right? And this is a condition that some women get when they have excessive androgen production, particularly caused by another condition called polycystic ovarian syndrome. And when that happens, androgens, obviously they're free flowing, they're going throughout the skin and the body overall. But in the skin, it causes for hair to grow. So any vellus hair that existed there already could be stimulated to the extent in which it turns into terminal hairs. So you're telling women and people in general to apply testosterone propionate. Okay, maybe you're not telling them to do that per se, but your video suggests that it could be used as an anti-aging sort of treatment, this topical testosterone. Without taking into account that, especially when it comes to women, it can, and it's likely, to very well stimulate the hair growth in that area. It's possible. In fact, it's likely, right? It's likely. So, and this is an example of it having a localized effect, as you said. And when you go and look at this study that he's showing, this is someone's armpit. Yeah, you apply testosterone there, right? it's going to stimulate the hair growth over there, right? In some cases, when it comes to body hair, for whatever reason, body hair seems to love androgens. But also, excessive androgen production in a local tissue is not conducive for anti-aging effects, because all it leads to is more 5-alpha reductase activity in the sebaceous glands, and that leads to what? Further acne production. Sorry, further sebum production, and yeah, and further acne production as well. Right? More of that bacterium is going to feed off of the acne of the sebum, and it's going to create more acne. Right? Just look at this. And this causes for a further inflammatory response to the area, because your immune system wants to kill that acne bacteria, that propionate bacterium, right? So this is really ridiculous. I don't understand how he's able to just get on camera and say these things as a doctor. Listen, I'm not a doctor. I make mistakes all the time, but this is a pretty large mistake. And, talking about older studies, you don't even have to go that far back from the point in time in which he was talking about, right? I think I have a study over here somewhere. I can't seem to find it now. Yeah, okay. So this study was from 1975, if I recall correctly, and it's from Vera H. Price, and it already talks about how they already know that DHT and testosterone, androgens in general, are related to various conditions like acne vulgaris, idiopathic hirsutism in women, and androgenetic alopecia, also known as common baldness, and it's all caused by androgens in genetically susceptible men and women. And it may be the result of such temporary excessive DHT formation in the affected skin. So it's been known for a while, and this is as far back as 1975. This paper over here, right? November 1975. So if we've already known this for that long, why Dr. Abs gives this sort of impression that topical testosterone propionate and topical testosterone is the enemy to the skincare industry because it has very, very good anti-aging effects, when in reality, no, it can cause a lot of issues. Aside from systemic absorption, right? Because systemic absorption can happen. The tissue area is of major concern. You influence an excessive amount of sebum production because you're having more androgen activity, you're likely increasing the chances of acne proliferation. And from that, you can get scarring, right? Acne vulgaris, like I said before. These are things that are possible. So, Dr. Abs definitely, I have criticism of him. And this is probably one of my bigger criticisms, just this particular video alone. Like, you're presenting this as if it's groundbreaking new data, and that the industry was kind of hiding it or something, which in reality, that doesn't seem to be the case. It's just that it's not a wise skincare thing to do to apply topical testosterone. And not only that, but I don't want to get at him for diet, but this whole promotion of a carnivore diet or strict carnivorism, it's just how do I say? Short-sighted. Very short-sighted. So this guy who's a doctor, just this video alone, talking about how testosterone propionate can de-age the skin, bad idea. Bad idea. Don't do it, guys. Don't apply testosterone propionate to your skin. Don't apply testosterone gel to your skin, thinking that it's going to de-age it. If anything, it could be influencing the presence of acne. And if you get cystic acne from this, well, that's going to suck, right? It's not going to, this isn't going to de-age your skin once it heals. Once these pustules, these acne things pop on your skin, you could have scars. You could have a very porous skin, right? And that isn't an anti-aging effect. If anything, it's a sign that you're getting older, and maybe you should get that life insurance. But anyway, thanks for watching this video. I'm not gonna play all of Dr. Abs' video. I'm not gonna play the full thing. I think just my criticisms is enough, and yeah, that's pretty much it. See ya.